Welcome everyone to the 2021 Global Animal Disaster Management Conference. Today's session is the impact of the COVID-19 pandemic on community-based animal programs in the USA, presented by Dr. Sarah de Jong, Assistant Professor, University of Delaware, and Dr. Ashley Farmer, both from the United States. This session is proudly sponsored by the C4 Group. It's a privilege to have both Dr. de Jong and Dr. Farmer present today. Their bios and abstracts are available to read from our website under speakers. Before we start, some basic housekeeping. The Zoom chat feature has been disabled, so if you have any questions at the end of this presentation, please use the question and answer feature and we will endeavor to answer these at the end. We encourage you to use the hashtag GADMConf for Twitter and other social media. A short evaluation will be made available when you exit this session. And just as a reminder, the video recording will not be available until it has been edited, and it will be released as part of our GAD MAC Awards ceremony in July. So without further delay, it's my pleasure to welcome Dr. de Jong. Dr. Farmer, the floor is yours.
Thank you so much, Geraldo. We're so happy to be here, and we just want to say really quickly thank you to Steve Glacy for organizing many aspects of the conference and for inviting us to present and making us aware of this wonderful event. And we hope to be able to network with many of you that are in attendance today and remaining days, and then also hopefully in the future at an in-person conference. So we're really excited to be here and we're thankful for your time. And so just a little bit of an overview about us. Oh, my slides aren't going forward for some reason. Hold on, maybe if I stop screen sharing for just a second, if that's all right with everyone. Okay, can everyone see the, oh, you can't see it.
No, you need to share it.
Yeah, for some reason it wasn't going forward.
Could you share it again?
Yes, let's try this again. Okay.
There.
Can you see it now?
Yep.
Is it going forward now for you?
Yep.
Okay, great. Sorry about that. Okay, so just a little bit of a background about Dr. Farmer and myself. Dr. Farmer is based at the University of Illinois, or Illinois State University, sorry, and I'm at the University of Delaware. We actually met working on a project together when I was a postdoctoral researcher and Dr. Farmer was a graduate student in sociology and criminal justice. And during that time, we were working on analyzing some data about hurricane decision-making from North Carolina. And so those data were from hurricanes that were in 2012, 2013. So I think this was Hurricane Ike and Lily and some other hurricanes that happened a while back, but we were analyzing some of the open-ended data from the respondents about general decision-making. And we noticed that a lot of the respondents, even though they weren't asked directly about the impact of companion animals on their decision-making, they decided they wanted to share that information anyway. And because they felt like that information was so important, we decided to begin gathering new data about pets and evacuation decision-making, particularly in hurricanes. And then we kept in touch when we both started our faculty positions at respective universities. And when we noticed that during Hurricane Harvey that a lot of people were refusing evacuation, we saw reports of this on social media that people weren't evacuating in Texas, and there were instances of dogs and cats in floodwaters. We said, well, hey, you know, this is obviously still a major issue. And so we wrote a grant for the National Science Foundation, and we were awarded a quick response or a rapid research award to collect data in Hurricane Harvey and Hurricane Irma. And we built on that work, and we ended up collecting data from multiple disasters with that grant funding. Here in this photo, we are in League City, Texas, and this was shortly after Hurricane Harvey. This cat in particular was surrendered after the storm because the cat's family was evicted and they lost their house after the storm. And so they had nowhere to go. And that created new challenges for that family. And we also deployed after several of the major wildfires in California, the Sonoma fire, or also known as the Tubbs fire, and then after the Camp Fire in Butte County, California, which is to date one of the deadliest wildfires in the United States. We also deployed for the Hawaii lava flow to do ethnographic field work to talk to groups there who were helping with evacuation and decision making. We deployed for Hurricane Florence as well in North and South Carolina. And then we did web data collection during Hurricane Matthew, which was actually before that grant. And then the Carr Fire, we also collected some web-based data. And each time we traveled, almost every time we deployed to travel, we brought students into the field with us so that they could learn more about engaging in qualitative research and rapid response fieldwork methodology. And so after we analyze those data, and our book is forthcoming, which we'll talk a little bit more about at the end of our presentation, we realized that even at the very early stages of the COVID-19 pandemic, that companion animals remained an issue, mainly because of some of the issues that we actually uncovered during our disaster research fieldwork during hurricanes. Okay, so some of these issues relating to poverty, health access, and inequality. And to date, there are over 485,000 deaths in the United States due to COVID-19. The United States ended up being one of the worst countries in the world to manage or fail to manage the COVID-19 pandemic. And as you can see in February, this chart is actually from a few days ago, but cases are finally now, for the first time since November, going down once again. But you can see that we had another spike very recently. And we were curious about some of the early news articles and reports that we started seeing about the impact of the pandemic on animal services, sheltering, and people who were owning, adopting, or fostering companion animals. And what we noticed is that there was a very positive spin on companion animals in the pandemic, particularly in the area of fostering and adoption. Now, this isn't entirely surprising to us because we did notice in hurricanes and previous research that people can leverage a crisis event to increase adoption rates because you can say, hey, listen, there's a hurricane approaching. We need more people to come and foster animals so that we can have more room for animals that are coming in from the floodwaters, et cetera. So what we found is that a crisis event can actually act as an agenda setting event for some of these organizations to ramp up fostering and adoption. But what we've also noticed too is that a lot of these positive spins and a lot of these stories that you're hearing and seeing in the media, they do focus on upper and middle class and white families. So even here, you see this is an upper middle class white family. Supposedly they're also homeowners, so financially secure families. So a lot of the stories early in March and April of 2020 focused on New York City and people who had a pretty stable financial income for doing this rapid uptake of fostering shelter dogs. And what we also noticed is that there were less stories about cats and other animals, which is also not surprising because we've also noticed a stigma towards cats in our previous fieldwork. And so again, what we've seen is that a lot of the organizations started ramping up their advertising and some of their public messaging using the COVID-19 pandemic as a way to say, okay, you really need to care about pet overpopulation, and now you need to care more than ever because of the COVID-19 pandemic. And what we saw also that was strangely missing from some of these information campaigns was the information that should seem obvious, which is that unemployment is increasing, and so surrenders will also be increasing. Or that would probably be the correlation that we would expect. But what remains unclear after looking at some of the initial framing and news articles, what we really were curious to know is if these fostering and adoption rates were sustained over time. And so there was initial interest where the public said, hey, I'd like to adopt or foster a new puppy or dog or cat because of the people who had the ability to work from home. Again, that's another impact of the pandemic, but also you see this is a disparity because people who can afford to work from home can most likely afford the extra cost of adopting or fostering a new animal, whereas we had curiosity about some of those invisible or silent stories where people who are struggling maybe could benefit from a companion animal from a mental health perspective, but may not have been able to stay home because they're an essential worker, they couldn't work from home, or they couldn't maintain that same upkeep of a companion animal. And so another thing that was missing from some of the guidance from the CDC, so even here as an employee of the University of Delaware, I engage in regular COVID-19 testing. I take a test before I go to the campus to make sure that I'm safe and that I'm not at risk of sorry, my cat's tail went right over the camera for a moment there. To make sure that we're minimizing the risk of spread for anyone who does come to campus or works in the office. And I've noticed even when I got the pamphlets after my regular COVID-19 testing, the CDC guidance says, if you're sick, you should not interact with your animals. And so that's interesting that that's the guidance because there has been an absence of information about boarding and accessibility for people who do have COVID-19 and how to find affordable boarding if they do have COVID-19 or if a family member has COVID-19, someone in the household. And again, what I've mentioned previously is that new unemployment may lead to an increase in animal surrenders. And so we were curious to know if that was actually happening or if that was just speculation. And another thing that we were interested in finding out more information about was if people were going to be using companion animals as coping mechanisms. We are all familiar with some of the literature that shows a reduction in stress if there is a bonding or attachment with companion animals. And so we were interested to see if people were beginning to demonstrate noticing differences in their stress level because of the ability to keep a companion animal. And so we decided to do primary data collection. This time we couldn't do field work, even though we love deploying and talking to people face-to-face about their experiences in crisis scenarios. We felt that there was a benefit to launch an online survey and do that very quickly because the benefit of that is you can gather a lot of data from people in a lot of different locations and you can do that very quickly. And there are some drawbacks to that form of data collection, which we're happy to talk about a little bit more later. But the IRB for this data collection was approved by the University of Delaware. We launched the survey actually last month, and we recruited throughout multiple states and all regions of the United States. We targeted pets groups, and we used keywords when we were searching for pets groups that focused on things like fostering adoption, the word cat, dog, lost dog, and a lot of the same groups actually that we're already members of because of our hurricane research. We recruited participants in those groups. Our response rate after the short time of data collection, this is our preliminary data again, we'll likely expand this later as the pandemic continues and as vaccination rates change over time to see how some of these numbers might fluctuate. But our initial response rate was 102, and 13 of those were people who represent organizations working in animal services, and about 90 of those were respondents who were representative of just a household with a companion animal. And again, the sample was very white. We've encountered this issue before with recruitment, that the sample tends to be fairly homogeneous and middle income respondents. And this will be, Dr. Farmer will transition to the slides now. So I'm going to stop the screen share.
And I'll add mine. Here we go. All right. So I don't want to rush, but I also want to make sure that we have time for Q&A. So I'm going to talk about some of the preliminary findings that we have here. First, just an overview, starting with the organizational responses. We had a wide variety of different types of nonprofits, no government-based organizations, but the other indicated here was a freelance rescue. And they provided a wide variety of services. So they indicated that they provided services in adoption networks, they provide clinical vet services, one even does disaster and evacuation work. They had community trap, neuter, and return organizations here, animal food pantry, boarding, and fundraising. So a lot of different things that these organizations were a part of. And also they mostly dealt with cats and dogs. So one organization did mention small animals, but primarily here we are dealing with cats and dogs. So the key organizational issues that came up from these responses, the first was a loss of fundraising from the cancellations of face-to-face events. They were not able to do public fundraisers for much of last year because of the pandemic. One respondent indicated that because of the inability to do in-person fundraising, they brought in about half in 2020 of what they did the previous year. Their in-person fundraiser in 2019 raised $20,000, and last year they only raised $7,000. So these organizations were taking a huge financial hit. They were also not able to hold any adoption events face-to-face, and that also brings in money for these organizations. They also had a decrease in general donations to their organizations. This is likely because of financial issues that individuals experienced last year as well, not having the capacity to donate as much. So for instance, one person who was a foster, animal foster, they indicated that it was really hard to get adult cats adopted, especially those with special needs, and everyone wanted kittens. And so the donations to rescue organizations were really down, and they ended up having to cover some of the medical expenses for their foster cat that normally the rescue organizations pay for, but they had to take on that burden themselves. You also have a loss of income from spay and neuter services. So the low-cost clinics had to close for months on end. There were no adoption fairs, as I mentioned, for fosters to get spayed and neutered. So they didn't have these services for some time. Another consequence of that for these organizations is that because there were a lot of cancellations of appointments as well, especially from the period from March through May, by that time, when they were able to get cats in again, a lot of the female cats had already had kittens. And so their local spay and neuter clinic was also asked to handle the scheduling of all TNR, trap, neuter, return appointments, and they had to do the transportation for those cats over several months as well. So you also saw an increase in workload for those particular organizations. Many of them also had to adapt to drive-through services. This is especially true for adoptions and vet services. So having to quickly adjust to not allowing clients in the building. They would meet clients at the car, take the pet inside, and then call the person to talk about what was wrong with their pet, or if they were just doing general checkup. So they indicated that one of the biggest issues here was overworked staff. They also indicated that they had to change a lot of internal operations and protocols because of COVID-19. On this particular question on our survey, most organizations agreed that they had to do a lot of changes here. They also had to do adoptions by appointment only as well, which complicated some things. And then screening challenges for the influx of foster and adoption. So as I'm going to talk about, there were a lot of people who did adopt during this time period at the start of the pandemic. So one organization indicated that they were screening adopters that might have good intentions, but they fall into the category of being a COVID adopter, which can result in the return of an animal to an organization, and they obviously want to avoid that. Another organization indicated that it takes time to provide vet services and medications, and that takes so long that they were not able to take in more dogs to put up for adoption as they usually would. Interestingly enough, on the question of has the COVID-19 pandemic led to an increase in animal adoptions, most organizations indicated that this was neutral, with several agreeing that they did increase. So one organization said during the beginning of COVID, they had an overwhelming amount of people come forward. They wanted to adopt, they wanted to foster if adoptions weren't available. And so even though that did not continue throughout the year, they did expand their foster network considerably. considerably. This is just an example of when we talk about changes to protocols and operations, making the public aware of some of those operational changes as well through news stories such as this. So this in particular about adoptions, having to make appointments for that. Some respondents indicated in the individual responses that one of the complications here is that they were not really able to meet pets before they adopted them, which can also result in a lot of pets being returned to shelters. So looking to the individual responses and focusing on the key companion animal issues for households, over half of the respondents who took our survey, 53%, said that they did adopt a new animal during the pandemic, and almost a quarter of them actually fostered a new animal during the pandemic. And so as this quote indicates here on the bottom right, that they were working from home 100% of the time and would have probably had more mental health issues if they didn't have their dog and then the 2 kittens that they adopted. So many of the responders were indicating things about mental health, dealing with stress because of the pandemic. They also said that they had more flexibility often because they were working from home. So as Sarah mentioned, this idea of coping companions, it was a way to cope. And so you had a lot of people adopting pets also out of loneliness, as is mentioned in this quote as well, to sort of help them with the depression and the mental health aspects of the pandemic. And other key issues here, 35% of respondents indicated that they did delay routine vet checkups because of the pandemic, and that obviously has some consequences as well. 15% had new unemployment issues associated with the pandemic that caused financial difficulties. So this was a highlight too. There's 2 separate quotes here from 2 different respondents, but also thinking about pets that were given up because owners had passed away as well as financial issues. So for instance, you have here, someone indicated that they did have COVID and they actually delayed treatment because they could not find anyone to care for their pets. So that could have been a very problematic situation that they actually delayed going to the emergency room for COVID. They did eventually find some friends in their network to take care of their pets, and then they boarded some of their special needs cats. But as you can see here, it cost them $100 a day. So even though they're still sick and suffering from some long-term consequences because of COVID, they had to bring their cats home. They can't afford to board them any longer. Someone else also indicated that they used their stimulus check for vet care. In the United States, there's been 2 stimulus checks so far. The first was $1,200. The latest in December was $600. And those were one-time payments. And so the finances are very tight for a lot of households when it comes to pet care. And so thinking about some of the takeaways right now from our preliminary findings here, absolutely the financial impact that COVID-19 has had on both organizations and pet owners themselves. So being able to afford routine pet care and checkups, but also how shelters are managing without having the donations come in that they would typically have. Adapting and changing services. So those vet services, for example, are going to last, into at least the near future, where people are not able to go into the vet with their animal. And so having to come up with other means of communications between people bringing their pets in and giving them these services or adopting pets, but also looking more into the increased adoptions at the height of this pandemic. It has leveled off. A lot of people indicated that it has leveled off, but we do need more data on owner surrenders because of increased unemployment. And again, to stress the financial impact here, that is something that really could have long-term consequences for pets. So just in conclusion, we'd like to point out that we do have a book forthcoming on Temple University Press. It's going to be out in June, All Creatures Safe and Sound, The Social Landscape of Pets and Disasters. And this is, as Sarah mentioned, from our field work across 7 different disasters in the United States. So we look forward to talking about that. And if there are any questions that we cannot get to, this is our contact information for Sarah and myself.
Thank you very much. Dear doctors, the floor is now up to our audience. We have a couple of questions. The first one is from Greg Richards. Please ask Dr. DeJong, how could technological solutions support the work of first responders during the disasters?
Yeah, that's a great question. I think, well, especially if we're looking at the case of coronavirus, there were a lot of instances, unfortunately, that we heard in the first responder community of people in, especially New York City in early 2020, when the pandemic was worse for New York City, when people would pass away in their homes or apartment buildings, and then the pet would just go immediately to the county or city shelter. And if the family members were coming to get the cat or dog, it's not clear that the reunification process was streamlined. Hopefully there was some method for contacting the next of kin or family members for those folks. But anytime you have a mass mortality event, tracking is always really important. So some method for centralizing information and tracking animals would always be important, whether that be, microchips or another form of making sure animals are tracked through as they move from organization to organization or place to place. Absolutely.
Thank you. Dr. Farmer, a question for you. Do you have any data on vets having to charge less to support lower income pet owners?
We don't have data on that, but it's a good question. And I think that's something that perhaps we could add if we do a second round of these surveys. I have personal experience with that because my dog had emergency surgery twice in December, and they did actually work with me on the finances for that. But we don't have data on that in this particular survey.
Great.
It's a good idea.
The next question for you two. Do you plan to do any longitudinal studies on animals adopted during COVID-19?
We haven't started longitudinal data collection yet, but that was one of the reasons why we started this this new exploratory study with this preliminary data for COVID at this point in the pandemic, because I think it would be important to follow up with some of those folks who adopted during the pandemic. What I would be especially curious to know, which is something we found in disaster research, is that when people do adopt or foster animals through a crisis, they actually report significant bonding compared to animals they fostered just in regular non-crisis times. And so we've actually talked to a lot of people who said, oh, I fostered up to 100 animals, but the animal that I survived Hurricane Harvey with was the dog that I adopted for myself, because that foster dog was survived the hurricane with me. And so we're anticipating we may see some of that kind of information associated with the pandemic. A lot of people saying, well, I really bonded with my animal, especially if there were family members that died of coronavirus and the animal was there as a comfort companion during the mourning and grieving period. We anticipate that that would increase the bonding level between that companion animal and the family.
Great. Next question. Did your animal care provider survey incorporate any statistics surrounding pet food pantries and the increasing need from the communities?
That's a really good question. Ashley, do you want to speak to that, or should I?
Yeah, I believe we did have a question regarding this, but currently the organizational response rate is kind of low. So we're hoping that we can get more organizations to respond to the survey and we can get a better idea about this specifically. I don't know if you want to add to that.
Yeah, one thing we did notice in just some of our, ethnographic research on observing some of the online pages is that we did see people who wanted to go to a pet pantry, but they couldn't because they didn't have a personal vehicle. So in the United States, because it's many places are rural, a lot of people actually don't have access to public transportation. And so pet food pantries are set up as drive-through. And if you don't have a car, that's actually a problem. So I think a lot of the organizations like Meals on Wheels or other organizations that are already doing outreach for low-income families should incorporate that understanding of home delivery for those households that are more vulnerable.
Next question, will you repeat this survey in 2021?
Yeah, we are continuing to gather data on this. So it's still open in terms of gathering data. I also noticed a question from Joshua in the actual chat, not the Q&A, but about the nature of suitability screening to identify COVID adopters, and did respondents provide any info on their approach to this? I think in general, it seemed as though from the open-ended responses that their approach was really just making appointments. For example, that was the biggest thing, to have people come in and sort of meet one-on-one with animals because they couldn't come in at any point in time that they wanted to.
Okay, and probably, I don't know if this is the last question, is there any data on animal socialization issues during COVID? For example, dog parks closed, many daycares closed, hard to do dog training classes for puppies, etc.
Yeah, that's not something that we looked at, but we're still analyzing our qualitative data from the survey. So hopefully we'll be able to dig into that a little deeper as time goes on. And that's something that we have on our radar in terms of exploring more.
I will add to that that some individuals did note that in their open-ended responses and say they were concerned about the socialization of their pets not being around other animals the way that they typically would have been previously.
Okay, a couple of more questions. In a pandemic situation and as a support for vulnerable or economically disadvantaged animal owners, are there any arrangements in place by governments to support owners by supplementing or providing vet services at reduced rates?
So I would say in the United States context, that varies by state, and some states do this really well, and some states do this less well. A really good example would be Hawaii actually has a lot of voucher programs that were in place before the pandemic. And our hypothesis would be is some of these states who had these support mechanisms in place, they fare better in and after disasters, and then also the pandemic, because they already have more of a handle on understanding the dynamics of pet overpopulation. So that's a really great question and something we hope to continue gathering data on as well.
One more. Has there been an increase in animals requiring foster/adoption as a result of their owners turning COVID positive, including those who have lost their lives?
Yes, we have seen instances of when, in fact, I'm in a local cat group here, and one of the owners died of COVID, and so the cat was surrendered. In fact, we see that almost every day now in the United States and all of the pets groups, people who are looking for homes for pets that lost the owners due to COVID.
Great. Any final thoughts, ladies?
No, we're just really thankful that everyone is here, and we hope to continue working with you all and hopefully finding some solutions to some of these critical issues. And again, look for our book when it comes out this summer, and feel free to email us.
Well, the $50,000 11th hour question, any information on pets turning positive to COVID?
Yeah, there was a cat in Pennsylvania last year that died of respiratory complications from coronavirus. Now, I'm less familiar with the literature on the canines contracting COVID-19. We do know that they're not a primary transmitter to humans, but what we would worry more about is people who go to dog parks, people transferring coronavirus from human to human because of the close proximity. So that's more of a concern. But I still think understandably people are worried, especially about older pets who might already have like respiratory issues.
Yes, and there was, I think, a news story about a dog in North Carolina that died of COVID as well as zoos are having to struggle with this issue. I know it's a little bit outside of the spectrum of what we're doing here with companion animals, but zoos have had instances of animals testing positive for COVID as well.
Well, thank you very much. This has been a very interesting presentation, as the audience has shown us. The next presentation is going to be Wildlife Response in Bushfires, Lessons from the Black Summer, 2019 and 2020 in North South Wales, Australia. Thank you all. Thank you, doctors, and see you soon.
Thank you so much.